Okay, so this video is going to be for the palpation of the wrist and the hand, as well as the hyperextension of the thumb wrap. So the first palpations that we're going to do are on the wrist joint, and those are the two styloid processes. The first one is the ulnar styloid process, so this one's pretty prominent here. We can see it. And then the radial styloid process is the one on the radius side. So if we get the patient to relax and we see where the that joint is, that fulcrum, we can definitely find the radial styloid process. So that's ulnar and radial styloid process. And then we also have the metacarpophalangeal joint. So that's the first metacarpal, and the proximal phalanx of the thumb. The metacarpal comes about here, and then if we get the patient to extend, flex and extend, we can find it about here, metacarpophalangeal joint. So metacarpal 1, proximal and distal phalanx. And then the scaphoid bone, the scaphoid process, we'll find that if we can find our patient's anatomical snuff box that Kristen mentioned in the video. So if we kind of get in between those two tendons and then have the patient relax and go into flexion and extension, we can really feel that scaphoid bone. So that's in there. Cool, so those are the palpations, and now we're gonna do the hyperextension of the thumb wrap. So the first thing we want to do is get our patient into slight flexion of the thumb. So just kind of tell them to maybe picture holding a can of soda or something like that, or shaking hand motion. So that's how they're going to be for the entirety of the wrap. And then we're going to start with the stretchy tape, and we're going to do an anchor. Not too tight, just a regular anchor. And then my patient here has a relatively small hand, so I decided to go with the smaller tape. Works a lot better. So all our tapings are going to start on the ulnar styloid process, and they're going to go around the thumb. So we're going to prevent that hyperextension motion. So here, we're going to start on that ulnar styloid process, come around the thumb, and then we make sure to not be too tight around here. We pinch, come around loosely, and then we end off on that styloid. Cool. Once more, styloid, pinch, come around here lightly, and then also, as Kristen mentioned in the video, when we're coming around, kind of put pressure on that thumb because it naturally wants to come up. And on the styloid. And now we're going to go the opposite way. So we're still going to start on the styloid process. Come around the thumb, pinch. Press down on the thumb. And on the styloid. And then once more, last one. Pinch. It's a little tough to get it nice and neat, but do the best you can. And then end on the styloid once more. And then just to finish it off, we're going to close it off one or so closing strips with a stretchy tape. We seal it. And then our patient should have restriction when going into that extension motion. All right.